Hello and welcome to HLA Live. This is the 5th episode of HLA Live, which is our weekly programme broadcast live on the HLA YouTube channel. Each week we talk to interesting people from the HLA community and beyond about the issues and topics that our community have expressed an interest in. The HLA has 6 pillars of leadership that we deliver our programmes on. The leader is a communicator, the leader is a manager, the leader is a negotiator, the leader is an innovator and entrepreneur, the leader is a follower, and the leader as a philosopher. Many of the episodes in HLA Live will cover one or more of these pillars. This week, we're talking about climate change and healthcare sustainability. This week's topic was the result of the work of one of our scholars, Rosie Spooner, through her HLA project. Rosie has put together tonight's episode of HLA Live with Pedra Eamon and the rest of the HLA Live team and brought together a fabulous panel of speakers to talk about this important topic. Chairing tonight's panel will be Rosie Spooner. Over to you, Rosie.
Thank you, Johan. Thank you for giving me this opportunity. And we have a fabulous panel of speakers who are joining us, who I look forward to introducing you to. What I'd like to start with is to ask you to imagine a global health emergency which forces us to dramatically change our behaviour in order to protect ourselves and those around us. Have you got one in mind? One which requires political will guided by science to help us respond. Well, I think you can see where I'm going with this. It's not the COVID pandemic that we're experiencing, it's the far bigger and further crisis which is set to affect our lives and those around us and all future generations to come. Firstly, I'd like to cover what I understand as the consensus on climate science before we ask some of our panellists to share their experiences of working on sustainability within the NHS. I have been reminded today that there are people out there who still question whether climate change is a result of human actions. And for the purpose of this webinar, I am not going to go there. I'm going to accept now that that is a niche viewpoint and anthropomorphic climate change is an agreed fact. There is strong academic consensus from the Intergovernmental Panel on Climate Change that if we are going to limit global warming to 1.5 degrees above pre-industrial levels, then unprecedented change is required. We are already experiencing the effects of a 1 degree rise. A 2 degrees or more rise will have catastrophic health consequences. In the last 40 years, we've emitted dangerous levels of carbon dioxide and removed about half of the world's birds, mammals and fish, invertebrates and insects from our planet. If we reduce emissions now and prevent a rise in temperatures beyond 1.5 degrees, we may be able to stabilise climate change. Beyond this, who knows? We may move through a number of tipping points and enter a period of warming that will lead to catastrophic breakdown. The GMC states that the duty of a doctor calls us to act promptly to protect our patients' safety, where we notice unprecedented or unacceptable risks to current and future patient health. And we have a duty of care to act for our patients and a responsibility to act now. We know the NHS employs about 1.3 million people and that it's responsible for about 4 to 5% of England's carbon footprint. That's not to say Wales or Scotland's. And it is estimated that 5% of all traffic on the road is NHS related. We know that the NHS has committed to try to reduce to a net zero carbon emission, and it's the first organisation in the world to do that, first health or care organisation to do that. But hopefully during this live session today, we'll be able to answer some questions around what is already being done, what we can do with health professionals to help raise the profile of climate change, what can we learn from the COVID pandemic, and where we will go from here. So I'm going to introduce our speakers next. So first of all, we have James Dixon, who is a chartered environmentalist and who has worked on the sustainability field for over 15 years. He joined Newcastle Hospitals in 2010 as a waste manager, and he managed to eliminate waste to landfill within the first year, saving over £200,000 in waste-related costs and reduced the trust waste-related carbon emissions by 75%, which is amazing. And due to his persistence, Newcastle Hospitals became the first organisation in the world to declare a climate emergency. So hi, James, do you want to wave in? Well, I don't know if you can see him, but there he is. Secondly, we have Anya Gopfert, who is a public health trainee who's concerned about the impact of climate change on health. Anya just completed the National Medical Director's Clinical Leadership Fellowship at the Health Foundation, where she worked on projects on the health and well-being of the as an anchor institution. She's been active and committed in climate change action for a long period of time. And then two clinicians we have is Farzad Sidat, who's an anaesthetic registrar at the University Hospital of Wales. He helped to establish the Welsh Environmental Anaesthesia Network and has coordinated a national campaign to reduce the carbon footprint from anaesthetic gases in Wales. And finally, but not least, we have Elaine Winkley, who's an anaesthetist consultant who's passionate about reducing waste and increasing sustainability. She's also an HLA scholar, and she founded the Waste Warriors Northumbria NHS. So welcome all of you, and I'd like to start off with a question. If you could answer it as a kind of panel, we'll start with James and then Anya. What lessons do you think that we can learn from the NHS in our response to the COVID pandemic in order to tackle the climate emergency?
Do you want me to take that first, Rosie?
Yes,
yeah. Okay. So what lessons? So this is a hot topic, obviously, at the minute. I think the lessons we can take is that we've been able to see massive scale and change across society, focusing on something that has been an immediate threat to our health, which you drew the parallels earlier, Rosie, to that. So I think what some of the benefits we can get from that is seeing that change is possible and massive change. So we've seen a huge seismic shift in how we go about our work, how we connect with each other in society. So I think change is possible. It's shown that it can be. So drawing parallels into the climate crisis, it means that the fundamental changes that we know that need to happen can potentially happen. So I see some positives that we could potentially exploit. I don't know if exploit's the right term, but certainly utilize some of those lessons that we can take those forward. We've seen benefits from reducing travel and reducing demand on our clinical services, particularly outpatient appointments and attendances. So if we can look to harbour those benefits in other areas of our care pathways, that's something we could definitely benefit from.
Anya, did you have anything to add to that?
So other things that I think we could learn from the way that the NHS has tackled COVID are how, for the first time in kind of history that at least we can remember, public health has been put as a priority over and above kind of many other things. And it demonstrates just how that thinking can be applied. But I think there are some things to be learned as well from kind of maybe not mistakes necessarily, but omissions that were made in the way that the NHS responded to COVID. So I think what would be really important in terms of if we were to be able to get people to implement some of the large scale changes that are required for tackling climate change, is to also think about how to do that in the most equitable way possible. Because I think a lot of the things that happened with big rapid change around COVID were done on a broad population level and the same for everyone. But actually, we might need something slightly more nuanced to think about how different people access healthcare and how to make sure that that kind of change is instituted in a sustainable kind of and equitable way. And one of the other things that I think would be a really good positive to bring from COVID is that really people rallied around together and became really kind of cohesive, supportive teams for each other. And I think that that's something we really need if we're going to institute like really large scale change that's going to be meaning that people are doing their jobs in a really different way to what they used to. Having those kind of mutual supportive teams is really important, and I think that's something we can really build on.
Thanks for that. Would it be possible for Elaine or Farzad to add anything further, or shall I move on to a more clinical question?
I think one of the things has been behaviour change, that we've managed to implement that massively with social distancing and also the wearing of masks. So it shows that repetition and reinforcing the points can get behaviour change to happen. And it would be great if that would happen in like the greener strategy as well within the NHS and outside of the NHS.
Yeah. And Farzad, quick point?
Yeah, I think it's just demonstrated the value of having a centralized system, the NHS, and the value of networks. There was praise in the media yesterday for the recovery trial, which was across 176 centres, thousands of patients, because we have a centralized NHS and we're able to coordinate like that. The strength of research networks. That's why we're trying to build up a Welsh environmental anaesthetic network. You contrast that with a fragmented system like the US. And that's a real positive. And I think there's been a political move in recent years to increase marketization forces and increase a fragmented system. And we just need to remember that if we're going to respond to huge crises, we need to do it in a coordinated way and to maintain strong networks.
Thank you. I really feel that the response to COVID has brought a lot of people together. And I think if we can take that forward, in the next crisis, we should be able to meet it better. Now, one of the things that has happened during the pandemic is that we have had to change the way that we've practiced medicine. Now, one of my concerns about action on climate change is, do you think there will ever be a point whereby a treatment will be denied to a patient because of its environmental impact? And in which case, is that ever going to be something that we would tackle together? I mean, it's particularly towards anaesthetists, because I know that there's talk about changing the way that we practice anaesthetics.
Sorry. Yeah, sorry. So yeah, I mean, I wouldn't put it in quite such stark terms, but I would say yes. I mean, realistically, that's basically as part of our project what we asked people to do. We know that one of the gases that we used to use in everyday practice was actually a really potent greenhouse gas. And we presented this to our department and departments across Wales. And we said that, you know, when you're choosing how to do an anaesthetic or any clinical decision, you have a decision-making matrix. What are the risks and benefits? And that's not just to the patient, you know, you're thinking about the logistics of how your operating list is working. And all we said to people is that you need to add into this decision-making matrix that there's actually a really big environmental impact. And if you can choose an alternative treatment which maintains quality patient care with minimal risks, then you perhaps should go down that route. And that's just what we need to do throughout medicine, just in our decision making on a day-to-day basis when you're choosing a treatment path for somebody or you know, protocols in the department. You just need to add to that matrix, what is the environmental impact? We had a really great speaker at the Welsh Environmental Anaesthetic Network conference last year, and I'm afraid I can't remember his name, but he did say, he made this excellent point, that the first rule of medicine is to do no harm. And crucially, it doesn't say do no harm to the patient in front of you, it says do no harm. And if you're making a decision that has an impact that's doing harm further down the line, then you need to consider that as part of how you come to your clinical decision.
So yeah, I totally agree. I think one of the elements that we're looking at is finding an alternative rather than refusing a treatment totally. And that's coming into the realm. I know you mentioned anaesthetic gases. We're also looking at things to do with delivery suite and the use of Entonox and nitrous oxide, which is also harmful to the environment. And in our practice, it's whether we're going to look at whether an epidural should be the way forward for pain relief, and we actually start to wind down on our use of Entonox, but that's obviously quite a controversial issue because some women have certain ideas of what they want for analgesia during their labour and delivery.
So, and just to add to this from a public health perspective, so I think from thinking about, I don't think a treatment would ever be denied directly because of its environmental impact on somebody, but I think that it is important to think about how best to use our resources. So the least environmental impact that we would have would be if we prevented people from getting ill and invested a lot of our resources there and didn't prescribe medications that maybe people didn't need or that they weren't going to take anyway. So these are kind of really important kind of preventative questions to bring into this, and how we can reallocate our resources within the system to ensure that they're being used for the best care for patients, but also for the minimal impact on the environment.
And James, did you have any further comments to add to that?
Well, I feel underqualified being the only non-clinician on the call. I would echo everything saying from a high level, so I can't really make the decision as to where that care would be removed or other considerations, but certainly it fits with some of the work that we do in the environmental sustainability professional field of demand reduction at the core. So if you can reduce demand, like Anya's just mentioned there, then you are limiting demand on resources, on planetary boundaries that we're exceeding. So investment in ill health prevention is always going to be good. So I'd probably just make that point as well. And then if we've got options to be lower or zero carbon interventions in medical terms, not to mention engineering terms on buildings, then that should be the next preference after that.
Okay, thank you very much. I'm kind of getting a sense that there's both sort of clinical impacts that we can do, but also wider impacts that probably is more your field, James, where you work towards. Now, one of the things that we have been given a lot of media coverage during this time is as kind of the voice of health professionals seems to be taken a lot more seriously than it's ever been in the past. And particularly like public health, like Anya mentioned, seems to have been given this, you know, when did public health ever become so important? It's never been this attractive as a kind of field or to have so much power and influence. Now, one of the things that's difficult for people is to work through media to get this message out. And have any of you had experience or worked with media to try to highlight climate change as the kind of emergency it is, and how would you advocate to other health professionals to do that? Anya, do you want to start first with that?
Sure. So I think one of the kind of powers of being working in the NHS and also being a clinician is that people do, at least to some extent, respect what you have to say, and the media are also quite kind of willing to respect that. So you can get media kind of to pay attention to you as a healthcare professional. And when engaging with media, it's really important that you are thinking carefully about potentially what the agenda is of the person that you're engaging with. So quite often they have preconceived ideas about how they would like the kind of story to go or particular agenda. So it's really important, if you do engage with the media, to think really carefully about what kind of story you want to tell and what kind of story they might want to tell, and try to enter that conversation in an informed way. But I think one of the most kind of impactful things that you can do as a clinician is engage with your local newspaper and maybe your local radio station, because they will and engage kind of on apply climate change, some of the issues, to a local level and engage the local media on that. So I live in Camden at the moment, and about a year ago we did quite a lot with the Camden New Journal talking about air pollution in the area, air pollution around schools in the area, and a couple of other things. And they were really keen to have the doctor voice on that, and published a few articles. And I think that they got taken up quite well as well. So I think that's a really good place to start with media.
Okay, and Farzad, you've done some interviews.
Yeah, we sort of, I mean, I would just reiterate what Anya said, that just by being a doctor, you end up having this sort of respected voice. And we ended up sort of doing features on the BBC kind of by accident, and just, you know, we know that politicians and journalists are the least trusted professions out there at the minute, and doctors remain amongst the most. We started, I mean, it started off as a letter I was going to write personally to Cardiff Council after lockdown about keeping it pedestrianised and things, and Cardiff pedestrianised, and it became a letter to the Welsh Government from the Welsh Environmental Anaesthetic Network. We got a few other environmental medical networks involved, and then you're sort of covered on the BBC. And it just really brought home to me what Anya's saying, that you do have a platform, you are a respected voice. I think it's important to remember why that is, and to try and stay on the areas that you're seen as being an expert. It might be tempting to talk about the sort of ecological impact and the economic impact, but really people will really listen to you if you talk about the health impact. And a lot of people don't know, you know, a lot of people don't know that the World Health Organization is predicting 250,000 deaths per year from 2030 as a result of climate change, or the deaths as a result of air pollution. There's a lot to talk about, and You know, yeah, you can take it far. I just looked it up. There were, in the last election, there were 10 doctors elected to Parliament. You have a platform, and yeah, just my advice would just be to remember why your respect is, and keep it on health to begin with, certainly.
And James, do you want to add to that?
Yeah, I mean, echoing what everyone's already just said, I think from my point of view, you guys are one of the most trusted. I think only second to nurses, I'm afraid. They tip you by 1% on the last Ipsos Mori survey. So, but you know, head and shoulders above the rest are the healthcare professionals as a trusted voice. And Farzad, you're right in that the language of health has never been more impactful. So I certainly saw benefits when we engaged with our leadership team to get us to declare a climate emergency. It was a priority for us as patient health. Do no harm. Farzad's already mentioned that. That's the kind of stuff that the work that we were doing was causing harm across wider society. So we shouldn't be doing that. So that certainly echoed, and that was us internally. And then when we've gone external and heard more from other groups, it seems to resonate really well when doctors and other medical professionals are using the language of health and the impact that the climate emergency is having on health. So I've been in the game for a few years now, and nobody listened to me as much as everyone listens to you. So if that's anything to take away from today, and I've known the science for a while, and I've got a wife that's a psychologist, so I've known how to enact change and behavior, but nobody's been listening. So you guys, yes, for a take-home message is use your trusted voice. Be mindful of how you use it. Farzad's picked it perfectly there, and enact the change that we're hoping that will lead to better health for everyone.
And when you say enact the change that will lead to better health for everyone, James, I know that several of the people on this conference have done projects that have been looking at that. What are the barriers to actually making those changes? You know, when you've looked at waste reduction, when you've done anaesthetic gases, what is it that stops people changing? Because I think it is generally agreed now that there is this emergency, there is an interest in it, and health professionals want to do good things for their patients. So what is it that's stopping us? Why are we not making the changes?
Wow, that is a big question. So sustainability and wider climate emergency and ecological emergency is multifaceted and is huge. So just come back from a team session today about how we target set and the things we concentrate on. And if I just talked about waste, I could talk about it for hours as well. But I think if you step up above that, and so you answer your question, Rosie, about how we haven't been able to do it. We haven't been able to enact the appetite that we've had to deliver on change, and that a lot of people have wanted to do. So I think that's systemic. I think one of the lessons I've had from really lobbying the leadership team to declare was more about, I wanted top level support for this. And, you know, a climate emergency was just a kind of wording that emerged that I was able to have a hook to deal with. But that has, David Pension put it so well on one of these sessions just recently, that type of commitment from your leaders legitimizes action for staff. So I'm starting to see the benefit of that. So if you can gain top level support, Simon Stevenson said it, that it needs to be a priority for greener NHS. So if we can truly have that level of commitment, then you start to empower staff to be able to deliver on it. The only thing that's missing is the structure and the scaffolding around that. So how can you make your clinical decisions that are right? You know, we've touched on the environmental impact and balancing that. How can we have the workforce empowered to know what to do in all areas? That's clinical and support. And then how can our estate, you know, decarbonize as fast as possible to meet those targets? So it's complex, it covers lots of different areas, but leadership and the structure around it, I think, will be the ones we want to try and push for.
So I think sorry, I was so intently listening to James that I wasn't thinking about what I was going to say. I think it's really important to listen really closely to what people have to say about anything that you want to do or any of these issues that you raise with them. So people will be at completely different points in their journey with regards to what they know, what they're willing to do in their own lives, what they're willing to do within the workplace, what they think is a realistic amount of change that you're asking them to make. Like the whole spectrum, they'll have their own opinion. And I think it's really, really important before you engage on kind of bringing across your own opinion or your own idea or whatever it is, that you really listen to where somebody's currently at and why they think what they do before kind of, because then you can engage with them on a level that they then understand, or that maybe addresses some of the issues that they might have or some of the understanding that they might have. So I think one of the key things that I've learned in trying to do this is that, like, really trying to understand what somebody knows and thinks and why before kind of jumping in with anything else is really kind of important starting point. And that applies to everyone, whether that's your super senior leaders, your like colleagues, or patients, or anybody. That's kind of a really good starting point. So I'll just leave it at that for now.
So I kind of agree with Anya quite a lot in that the changes that we've had to make, I had to engage with people and talk about it a lot and try and find out why there were barriers to change. And I think in my last year of trying to improve recycling and sustainability in our trust is that I've asked the question why a lot, and why do we do certain things? And a lot of the time you don't get an answer, and it's just been something that has happened and is the culture of an organisation. So I think by challenging things, you can find out why things aren't happening and then plant little seeds as to how we can improve things. And certainly for my journey, it's been getting people on the shop floor involved and asking the question and getting them on board with me to generate momentum. And I think if you can generate momentum and enthusiasm, then it can carry a change forward.
Yeah, I just, in terms of getting change within organisations in the NHS, I've talked about how the values of the NHS and how good it is at times, and other times it's this great big lumbering beast where change is glacial. You know, we're still using bleeps and fax machines. This is 1980s technology. It's insane. But in terms of, you know, people are often quite resistant to change. In terms of change, specifically with regard to climate change, I think as hard as it might be for people in this sort of discussion to believe, that a lot of people still aren't really that informed. A lot of our colleagues, you know, anytime I've given this presentation around anesthetic gases to lots of my colleagues, they don't realize how much damage we're doing, and actually really how bad it's going to be. And sometimes you know, if you have a discussion with somebody, you know, over the dinner table, over the internet, it's not an information deficit model. You're not going to just give them the information, they're going to change their mind. But sometimes in that forum at work, actually that is what's missing. And you know, it can be a case of education and coordinating that education. And that really helps people get behind the change.
So, thank you. If anyone has any questions who's listening on the HLA Live, please post them on the Slack channel, and the link is also on the YouTube description. So if you link them in there, then we can answer them as they come up. Now, there are many resources that we're also going to put at the bottom of the YouTube channel for you to follow up and find out more about how you can get involved and where areas that you can take action. I think it's been a really interesting discussion so far about what stops us making change, just even though we've got the knowledge. I suppose all of you are still doing things, you're still trying, you're still enacting those differences, but do you think it's possible that we will limit the degrees of carbon? You know, will we be able to do this? And I suppose all of us are doing things that suggest that we do believe it. But has anyone else faced that kind of feeling of, oh, well, this is never going to work? With the pandemic that we've just experienced, we've seen huge changes in the way that we've lived, yet we're still not on target to even meet the Paris Climate Change Agreement's net reduction for this year, despite closing down the economy. Now, that kind of fills me with a sense of fear, but also I can't do anything else. What's my alternative? I've got to still keep going on this. And I wondered if anyone else has any kind of comments to make about that.
Yeah, I mean, yeah, I think you can get lost in climate anxiety, can't you? It's a real thing, and you know, sometimes you'll sort of sort out your recycling really carefully and cycle to work and avoid meat in your diet, and then you just look at the latest thing that Donald Trump said, and you just, you know, you think, what's the point at all? Having said that, as we've seen, COVID has shown us that we are capable of huge amounts of change. We are capable of it, and it is possible. We just need the urgency. And certainly there's conversations that I have with my colleagues in the coffee room on a day-to-day basis that this weren't on anybody's radar. So 5 years ago, nobody talked about the anesthetic gases. Nobody talked about any of this. Now we talk about it all the time. You know, I've eliminated meat from my diet, and that's a constant conversation in the lunchroom. So whether we're going to do it, I don't know. I think it's possible. I think we as a species and as a society are capable of it. And I've seen some encouraging signs. And, you know, for every Donald Trump that's elected, you know, that was a swing from somebody like Barack Obama. These things are actually, they're much finer differences between these huge changes than we think. So it's possible. And you're right. What can we do except work towards it? And try and be an example and try and nudge other people in that direction.
Yeah, I totally agree with what you're saying. I think we have to try and make small steps, however small they are, because small steps lead to bigger steps. It's certainly now entering the curriculum of different Royal Colleges, and the Royal College of Anaesthetists have a module on sustainability now. And I think we have to set the example, and we have to try, like with every walk of life. If you don't try, you're not going to get anywhere. So I think we have to try, even if we don't get to that target in the time course that we'd hope to.
Fars mentioned eco anxiety or climate anxiety, and I've certainly suffered from that. That's what actually I was in a depression after the IPCC report. Didn't really know it at the time as climate anxiety, but like I touched on earlier, the wife's a psychologist, so she quickly picked up on it. But that was a dark winter. But what it did lead to was a lot of soul searching and changing what I could actually change and what I could actually influence. And there's a great book called Active Hope, which I'd recommend. These always end up with reading lists, don't they? But I would look that one up. And that certainly resonated with me. And some of the work that I was doing outside of work as well, you know, connecting with your tribe, having the touch points, and actually seeing that you can achieve things where you have influence. So at work, I was lucky enough to have an influential position in an organization that was receptive to change, and that has resonated wider. And you know, that never would have happened if I hadn't been at that really low point, because the science was telling us that we were gonna, you know, we were in for an emergency and a crisis. So I would encourage people that are in a similar position to pick that up, or certainly take threads from that, because you can only, if you don't have hope, active hope in particular, it will lead to inaction and will not get anywhere. And that's what nobody wants. So we've got to have a fine balance of terrifying people, which I'm terrified every day with the status that we've got, and actually motivating people into actually, you know, following us on this journey.
So I think what everybody has said are really good points. I think though it is easy to feel overwhelmed by the scale of the challenge that we're facing, but there are lots of positives, and progress has been made in the last few years. So having worked and talked about climate change for years with people, it's definitely easier to have conversations now than it was 10 years ago. More people are aware of the issues, more people care. It might not always feel that way, but it's really important to keep going. And I think one of the best things you can do for yourself is at least feel like you tried as hard as you possibly could to do something about this. And the healthcare in the UK is kind of leading the way in lots of ways. Like the healthcare system in the UK is ahead of some other sectors, and the healthcare system in the UK is ahead of other healthcare systems. So we really have an opportunity to be kind of trailblazers and to guide other people and lead other people along this journey. So I think it's really important for all of us to think about what our power is and who we can influence, because everybody influences somebody. And most often you influence the people closest to you. So that will be your family, your closest friends, and your nearest colleagues at work. But sometimes just having those conversations can catalyze more change than you really realize. So it's really important to just do as much as you can. And yeah, to find kind of like-minded people who also care about the same things and share your values, because that makes the whole thing a lot easier.
Thank you, all of you. I mean, I'm feeling quite inspired by that. You've kind of inspired me to have hope that I can try and do more. I think one of the things that I've learned through the Health Leadership Academy is that even though we might not have all the power, we can still influence those with power. And even if we don't think that we're in a position of power, we are able to. And I think to give the example of Greta Thunberg, you know, she wasn't anybody 5 years ago, you know, and now look at her, she's able to speak at the UN, she goes and asks for huge change. And I think we shouldn't forget how powerful we are, even if we have a small voice. So I think just to kind of conclude where we're at, that there's some really, so James, did you want to say anything further on that? Did you?
Yeah. Sorry if that's okay. Just to say, the audience that we have here, what I think we've got here, don't underestimate your power in your organizations. And this is from someone from the inside as an environmental professional trying to affect change. The biggest changes we've had in care models, not to mention, you know, recycling and other things, have been brought about by engaged clinicians. And when I find them, I nurture the hell out of them. So if I met Fars and he wanted to do great stuff in my place, just like Ian Baxter and Kathy Lawson have in ours, I cherish you and I say, oh, I can help with that and I can do this. So never underestimate what you can affect. So you talk to anyone else in the organization, your consultants, your lead medics, they are the power in the organization of a power base. So it was just really to emphasize your point, Rosie. Don't underestimate what you're doing. And that's not just to say consultants have got it all, you know. Your nurses are trusted and your other healthcare professionals. But yeah, I would completely resonate with what you're saying. You do have the power, and if you're interested in engaging in what Elaine's doing is fantastic in Northumbria, it can be done.
Great. Thank you very much, all of you, for joining me today. Is there any closing comments that you wanted to make before I wrap up? No? Okay, well, I think we will have some comments coming in on the live chat, and we will try and answer those as they come. I've really appreciated all of you joining me here today, and I know that we've tried to cover quite a lot, and I hope that we will be able to take forward some of the things that we've brought out from here, particularly for people at home to come in on some of those links that are at the bottom there, so that you can read further and you can get engaged and you can take action, so that we can sort of try and help solve this huge issue as a kind of cohesive team together, because that's where our power lies, when all of us come together. Well, thanks. Is there anything else that you'd like to say, Johan?
So thank you to the whole panel and Rosie particularly for joining us and discussing this vital topic. I look at my children and it constantly worries me that the world we leave for them should be better than the one we receive from our parents. And with much of society, there's been incredible steps forward. We all hope that with incredible healthcare professionals like the ones you've heard from today, the healthcare system will deal with the challenges it faces in the future. COVID has taught us that the healthcare world we live and work in has had such a massive impact and so much wider than just the small society we think we live in. So many incredible takeaway messages have been expressed tonight, but I wanted to personally thank Rosie and the panel on behalf of the whole HLA community for tonight. HLA Live is thanks to Eamon, Alistair, Riddy, Tim and Pedra for their incredible work delivering the HLA Live programme. And tonight's discussion, as we said throughout, was thanks to Rosie and Elaine, actually, who's also a HLA scholar, who've both been heavily involved with the climate change activities and promoting sustainable climate change issues within the HLA community. We're incredibly lucky to have scholars that want to make a significant impact on healthcare across the globe and use the HLA as a platform to bring their incredible ideas and innovations to fruition. If you are interested in the work of the HLA, do make sure you catch a future HLA Live episode, join us at a HLA event, or apply for one of our programs to become a HLA scholar. Thank you for joining us. I'm Johan Malwana, and it is good night from all of us. Thank you.